Does arthritis pain limit how long you can walk comfortably? When you have arthritis, people tell you that the best thing that you can do is walk. And that's true to some extent. But it creates a catch-22 when you need to walk to get your joints to stop hurting, but you need your joints to stop hurting in order to be able to walk. Hi, I'm Dr. Dave Candy, and in this video, I'm going to explain just how much you need to walk in order to decrease your arthritis pain, and how to do it without increasing your pain in the process. Just about every major health organization recommends getting 30 minutes of walking per day on 5 days per week for a total of 150 minutes or more per week. And that includes the American Heart Association, the CDC, the World Health Organization, the American College of Sports Medicine, the American Geriatric Society, and the Ottawa Panel for Knee Arthritis. But if you can only walk for 10 minutes or so before your joints start hurting, then 30 minutes sounds really overwhelming. But there's nothing to say that those 30 minutes have to be 30 continuous minutes. So doing 2 to 3 shorter sessions of walking per day may be just as beneficial as doing one longer session, and in some cases possibly even more beneficial. A study in Gait and posture studied the effects of doing one 45-minute bout of walking versus 3 15-minute bouts of walking separated by an hour in between. And what they found is that after 30 minutes, joint loading forces increased in both conditions. But in intermittent walking, people reported less knee pain. Walking helps your cartilage health by stimulating chondrocytes, which are cells that lay down collagen and other structures that make up your joint cartilage, such as hyaluronic acid and chondroitin sulfate. It takes a certain amount of exercise to stimulate those chondrocytes, but after that, any additional exercise may not give you any extra benefit. In other words, you reach a point of diminishing returns. Now, on the flip side, the negative effects such as inflammation start to increase the longer you walk. And so the net beneficial effect is the vertical distance between the two lines. And you can see if you walk too long, then the net effect starts to become negative. Bodybuilding legend and 8-time Mr. Olympia Lee Haney was famously quoted as saying, "Stimulate, not annihilate." Now, he was originally talking about muscles, but the same philosophy applies to your cartilage. You want to exercise just enough to get the beneficial effects without exercising so much that you start getting negative side effects. And so by walking in shorter bouts per day, 2 to 3 times, doing it for shorter durations, you get more beneficial effects without the negative side effects. Now, the beneficial effects of walking start to come on rather quickly, maybe in as little as 10 minutes. If you think about the case of someone who has knee stiffness when they first get up in the morning, or who has knee stiffness after sitting for a while, once they get up and get moving, their knee starts to feel better pretty quickly. And so if you get 2 to 3 training sessions per day instead of one longer training session, you get 2 to 3 times the amount of stimulus. So instead of getting just 7 stimuli per week, you get 14 to 21 training sessions per week. And that may actually help compound your training effects. Now, that doesn't mean that you can only walk for 10 to 15 minutes at a time. If you enjoy walking and you'd like to be able to walk longer, and you'd like to walk maybe 60 minutes per day, then it may be more beneficial to break it up into 2 30-minute sessions per day or 3 20-minute sessions per day, provided that you can walk 20 to 30 minutes without increasing your pain. So you shouldn't have increased knee or hip joint pain when you're walking. Now, before we get on to the last section of this video, one other thing that has a growth curve shaped something like this is a YouTube video. It gets lots of views when it first launches, but then eventually it plateaus, unless the audience really likes the video. So if you found this interesting or informative so far, hit the like button and share it on your social media. That'll help tell the YouTube algorithm to spread this video to more people. Thanks for doing that. I really appreciate it. Now, finally, what if even walking 10 minutes causes you pain? What do you do in that case? Well, the beneficial effects of exercise are really from repetitive low-load movement. And that movement doesn't necessarily have to be walking. So you can do other forms of exercise such as water aerobics or exercise biking and still get the same beneficial effects. Again, it is probably better to do 2 to 3 shorter sessions per day rather than one longer session. Furthermore, how you walk makes a big difference in how much pain you're going to have when you're walking. And to learn tips on how to walk without hip and knee pain, check out these other 2 videos right over here. Thanks for watching, and I'll see you in the next video.